So first, Dr. Ned Murray from the FIU Jorge M. Perez Metropolitan Center will give the welcome remarks, and then each of our panelists will be discussing racial disparities and the next steps in South Florida. Today, our speakers are William T. Jackson from FIU Jorge M. Perez Metropolitan Center, Emanuela Jean Etienne from Urban League of Broward County, and Chief Paul O'Connell from Wilton Manors Police Department, Representative Cindy Polo, Florida State Representative from District 103, Charisse Grant from the Miami Foundation. And then at the end of the presentations, Q&A will be moderated by Helen Roldan from the FIU Jorge M. Perez Metropolitan Center. I will now turn the mic over to our center's Associate Director, Dr. Ned Murray.
Good morning, everybody. I hope all well. And welcome to the webinar on racial disparity in South Florida. And look forward to all the speakers' remarks. A little background on the Metropolitan Center. We've been around since 1997. In fact, a lot of our work over those years has been in the area of inequality, race, and particularly as it relates to economic development and housing, but also in overall types of issues. In fact, our focus areas are economic development, demographic research, performance management training. These are the focus areas that the Metropolitan Center has been involved in with our research over those 23 years. And regarding the topic of today, the studies that we've done, the Metropolitan Center first cut its teeth back in 2000 on this very topic. We were asked to look at the impediments to economic development in the Black communities of Miami-Dade at that point. This was 20 years after the Arthur McDuffie verdict, and there was a lot of studies, reports that ensued following that verdict, and obviously the riots that took place. The study that we did, that's showing on your screen to the left, was a study to look at that issue, look at what transpired in those 20 years, and what we found, not surprisingly, given all that we had heard and the interviews and the research that we had done, that not a lot had changed, that a lot of the inequalities, a lot of the issues relative to race and disparity was still prominent, and certainly in Miami-Dade, and certainly if we went up the 95 corridor, we'd find it in Broward and Palm Beach as well. Several years later, in 2007, we were asked to do a 30-year retrospective on the status of the Black community in Miami-Dade County, once again finding a lot of those disparities, a lot of those inequities that the 2001 study had found and prior studies had found. More recently, we were asked by Miami-Dade County in 2015 and 16 to do a prosperity study to really zero in on this long-term pattern of inequities in all communities, but with a real focus on the Black communities. And the data just revealed that. We actually looked at the whole county and then zeroed in on those areas where there was the greatest amount of distress. And sure enough, what we found from Miami Gardens south all the way to Florida City, what we refer to as the chain of distress, going down to 95 and US 1 corridor. Many of these communities where these inequities were found were in the Black communities along that stretch. At the same time, we began doing annual scorecards, working with Miami-Dade County's Economic Advocacy Trust, a scorecard around their 4 policy issues of the economy, housing, education, and criminal justice. And that scorecard developed a whole set of indicators under each of those policy topics. And that was very revealing as well, because the bottom line there is, since the recovery, the so-called recovery from the economic recession in 2011-12, during that period, there was still a lot of disparity, a lot of inequities, high concentrations of poverty in many of these communities. So here we are 40 years after McDuffie, and certainly many decades beyond a lot of the issues that we will be talking about today, and we're dealing with some of these same issues. And obviously they've been much more pronounced recently because of Black Lives Movement, because of what we're dealing with in terms of the pandemic, and the overall criminal justice system in the United States. So with that, I do want to say this, that I look forward to the presentation, and I'm particularly proud that one of our own, William Jackson, will be teeing us off. So we look forward to that and look forward to your discussion later on. Thank you.
Thank you, Dr. Murray. Now, William T. Jackson from the Metropolitan Center will give his presentation.
Good morning, everyone. First, I'd like to start off by speaking about the quantitative research for this presentation, which highlights racial and ethnic disparities in the areas of health, education, employment, housing, and justice across the United States, the state of Florida, and within the South Florida community. These disparities are highly represented within communities of color, especially when it concerns Black or African American communities in relation to their respective population, and in relation to communities of European descent, which are known as white within this research. First, I'll begin within the area of health. Health insurance is particularly significant as it provides access to preventive care. Throughout the years, the Affordable Care Act largely reduced health insurance inequities across races and ethnicities. In 2010, you'll see that all races and ethnicities were significantly less likely to be covered by health insurance compared to whites in Miami-Dade County. This means they were less likely to receive medical attention or preventive care, such as health screenings and checkups. Due to the healthcare costs, it also means these groups were less likely to receive medical treatment. Between 2010 and 2018, Blacks had an 11% increase in healthcare coverage. However, they are still lagging behind their white counterparts by nearly 12%. In 2016, Blacks and Hispanics in South Florida were less likely to see a doctor due to costs when compared with their white counterparts. Blacks were also less likely to receive preventive care such as a flu shot in South Florida compared to other races and ethnicities. According to the CDC, the leading causes of death, disability, and healthcare costs in the United States are heart disease, cancer, and diabetes. The Florida Department of Health data shows that Blacks are more likely to have some of these conditions in South Florida when compared to other races and ethnicities. While Blacks are just likely or less likely to have cancer compared to whites in South Florida, they are more likely to be diagnosed with cancer at an advanced stage, and they are also more likely to die from cancer. In these charts, you'll notice the rates of death are higher for Blacks from cervical, prostate, breast, and collateral cancer, to name a few. The CDC states that poverty rate among African Americans is high. The socioeconomic issues associated with poverty included limited access to high-quality healthcare, housing, and HIV prevention education, directly increases their risk for HIV infection within their health. Discrimination, as it is tied to the healthcare system, is also worth exploring. Studies indicate that racial gaps in health exist in the United States, and that implicit bias on the part of healthcare providers may be a contributing factor to higher patterns in hospital death for Black and Hispanics than for whites in the United States. In South Florida, infant deaths are more likely to occur for Black infants when compared with white or Hispanics. Maternal deaths are much higher for Blacks than they are for whites or Hispanics. Now we will move into the area of education. Public education is accessible regardless of racial, ethnic group, and economic status. However, there are numerous disparities within public education, many racial or ethnic, which tend to have a ripple effect, including in the workforce and higher education attainment. Enrollment in free and reduced lunch programs is significantly higher in districts within Miami-Dade, with higher populations of Black students. Among Black students countywide, only 6,467 were not enrolled in a free reduced lunch program. In Florida Department of Education data, Black students have some of the lowest graduation rates, just behind homeless, foster, and English language learner students. They also perform below the overall graduation rate in each county by at least 3.5%. In all 2 of 3 counties, Black students have a lower graduation rate than students from economically disadvantaged backgrounds. Now we move into the labor force. The labor force participation rate calculates the percentage of residents who are currently employed or in search of a job. In South Florida, when examined across racial and ethnic divides, the labor force participation rate shows that Black or African American residents have a lower labor force participation rate than white and Hispanic residents in Miami-Dade County, but a higher labor force participation rate than white counterparts in both Broward County and Palm Beach County. Although the labor force participation rate of Black or African American residents is relative to the rate of white and Hispanic students, the unemployment rate of Black or African American residents is significantly higher in each of the 3 counties. Although Black residents in South Florida have a labor force participation rate as high as or higher than white and Hispanic residents, the median earnings of Black or African American residents were lower than both their white and Hispanic counterparts. In 2018, Black residents made 43.6% less in Miami-Dade. Hispanics also made significantly less than white residents in South Florida. Due to the economic impact of COVID-19 on the South Florida economy, significant amounts of employment loss has occurred, especially in industries that employ large amounts of service sector workers. With the substantial amount of Black and African American workers employed in service occupation pre-COVID-19, they are expected to be disproportionately affected by the employment loss plaguing the service sector. In 2018, 30.5% of Black or African American workers were employed in service occupation compared to 11.9% of white workers and 20.7% of Hispanic workers. In each of these 3 counties examined, Black or African American workers had the highest percentage of workers employed in service occupations compared to both white and Hispanic workers. Now moving on to housing. While household income depends on geographical location and employment, it is also affected by racial and ethnic groups. This table displays that Black or African American households across all counties in South Florida have a significantly lower income compared to white or Hispanic Latino households. This greatly affects the Black or African American population and limits their options to find affordable housing. According to the Department of Housing and Urban Development, a household that spends 30% or more of their income on housing is determined to be cost burden between having the lowest household income and housing costs for renters. Miami-Dade County has become unaffordable for most of its Black or African American residents. Home ownership is seen as a symbol of wealth. However, South Florida, with its high housing costs and low household income, makes it difficult for Black or African Americans and Hispanic Latino populations to own a home. While there was a slight decrease of homeowners among these 3 racial ethnic groups from 2012 to 2018, the white homeowner population in South Florida is significantly larger than the Black or African American homeowner population. This gap can be widely attributed to the increase of residential prices. According to a recent Miami Herald article, median prices for single homes rose 4.4% and condo prices rose 7%. Whereas from April 2019 to April 2020. Now we will move on to justice. In 2014, Brian Stevenson acknowledged that by 2010, Florida had sentenced more than 100 children to life imprisonment without parole for non-homicide offenses, several of whom were 13 years old at the time of the crime. All of the youngest condemned children were 13 or 14 years of age and were Black or Latino, with Florida having the largest population in the world of children condemned to die in prison for non-homicide offenses. According to the United States Census, Blacks represent about 13% of the population. However, according to the Federal Bureau of Investigation, Blacks make up about 27% of arrests, 27% among individuals aged 18 and over, and 34.9% for individuals under 18. The Florida Department of Law Enforcement data shows that Blacks make up about 35% of total arrests in the state of Florida, even though Blacks only represent about 17% of the population. Blacks also across South Florida make up about 44% of total arrests in Palm Beach County, but only represent about 20% of the population, about 51% of total arrests in Broward County, but only represent about 30% of the population, and about 41% of total arrests in Miami-Dade County, but only represent about 18% of the population. According to the Florida Department of Juvenile Justice, Black youth make up about 50% of youth arrests, but only about 21% of the youth population across the state of Florida. In South Florida, Black youth make up about 59% of youth arrests in Palm Beach County, but only represent about 25% of the youth population. Black youth make up about 70% of youth arrests in Broward County, but only represent about 36% of youth population. And Black youth make up about 48% of youth arrests in Miami-Dade County, but only represent about 19% of the youth population. Black male youth are highly represented in Florida's juvenile justice system. Even though they represent less than 10% of the youth population in Miami-Dade, 18% in Broward, and 13% in Palm Beach County, this graph also shows a trend of disparities increasing among Black male youth as severity of prosecutions increase. Even though Black male youth represent one of the least populated gender and racial ethnic groups of youth in the state of Florida and across South Florida in relation to their white and Hispanic counterparts. Things to remember and take away from the justice provision is that Black arrests across the nation, state, and South Florida are about twice the percentage or more than Black overall population. However, among Black youth arrests, the percentage are much higher across the country and even higher within South Florida community. This is especially significant among Black youth. In conclusion, even though the data illustrated here shows a grim reality of racial disparities within the context of American society, especially within the South Florida community, it is important to mention that these numbers are mostly pre-COVID-19 due to the 1 to 2 year lag in the availability of data from multiple resources. However, current research is showing that in real time, the pandemic has and is currently exacerbating racial disparities in the United States and within our respective communities when it relates to the 5 essential areas focused on within this presentation. Thank you for your time. And now we will hear from Ms. Jean Etienne. She will provide us with a qualitative aspect of racial disparities, mainly within the South Florida community. Thank you for your time.
Hi. So thank you for having me on this panel. My name is Emanuela Jean Etienne. I am the Community Relations Coordinator at the Urban League of Broward County. And the mission of the Urban League movement focuses on closing the equality gaps which exist for African Americans and others in historically underserved communities to achieve economic self-reliance, power, parity, and civil rights. So the Urban League of Broward County serves over 13,000 individuals and families through 17 programs under 6 pillars. And that's education, entrepreneurship, jobs, justice, housing, and health. And our theory of change is that we will impact our community family by family, block by block, neighborhood by neighborhood. And our aim through our programs is to provide access to information and to provide the resources for individuals and families, not just to survive during this time, but also to thrive. And so when we're thinking about the root causes of racial and ethnic disparities in South Florida, especially as it relates to Black and African American communities, we have that historical perspective, right? We have slavery up until 1956. We have the legacy of Jim Crow that includes redlining and as well as, for example, 1941 with the GI Bill, that mostly helped white veterans move to the middle class without helping Black Americans to the same degree. And then we also have more contemporary examples, such as the 2008 housing crisis. We had discriminatory lending practices, and many in Black and brown communities lost their homes. So clearly the underlying cause is racism and disparate treatment for these communities. And so we're also seeing this in this moment play out because we have during the pandemic, we have unstable employment. We've seen food insecurity, the rise of food insecurity in our communities. We've had housing instability, and poverty in the Black community hasn't helped us in gaining access to healthcare or other resources. As William talked about earlier, there is a high cost of housing in South Florida, and coupled with the lack of livable wages means that families are spending much of their income on housing and not on saving or investing in their long-term future. And so with COVID, what we've seen is that most Black and brown families are blue collar and working class and have been impacted by job shutdowns. Or for the individuals who still have to go to work, they're putting their health at risk because they're still taking public transportation. They're still in industries that have to interact with people in a different way from other jobs where you may be able to work from home. We also know that one of the things that is about to be exacerbated is evictions in South Florida. So the housing moratoriums are about to end, and what we anticipate is seeing a flood of evictions that we aren't ready for. And if we know that Black families are more likely to rent and more likely to default on payments if they can't afford them, we will see a disparate impact of this pandemic on Black and brown communities. And so what we anticipate is that we're on the verge of an economic recession that is worse than the Great Recession of 2008 and will be and might be worse than the Great Depression of the 1920s. And so when we're thinking about the structure of unemployment payments, for example, right now, that is about to end. When we're thinking about the end of the housing moratoriums, we know which members of our community is going to be heavily impacted. So when we're thinking about solutions, because I don't want it to linger on the negative, when we're thinking about solutions, we will have to think about solutions that is mindful that Black and brown communities will be disproportionately impacted by the pandemic, disproportionately impacted by racism and discrimination throughout American history, right? And so what I view our role as a nonprofit is to build resiliency within our communities, is to provide access to information for these families so that they know how to prepare for the next steps, for example. So one of the things that we did at the Urban League, we had one of the first 2 walk-up testing sites in the state to ensure that families that didn't have public transportation could get tested for COVID. You could walk up to our testing site and get tested. And so that is one solution when it comes to access to healthcare. Another solution that we provided was our Families First program, which was originally created as a hurricane relief program. But one of the things that we know is that Black and brown families are more likely to live paycheck to paycheck, which means if you are out of work, even if it's for 2 weeks because you're sick or because you are let go, that can completely disrupt your finances. So because we knew that, we partnered with our philanthropic donors to create a fund that provided one-time assistance for rent and mortgage payments, insurance, and utilities. And so through our application process, we heard from a lot of families who just having that 1 month buffer allowed them to secure their finances in time and to kind of adjust. And so we have programs within various pillars, so education, entrepreneurship, health, housing, jobs, and justice. And our goal is to build that resiliency over time. We know that we can't anticipate everything that is going on, but we can provide the resources to help individuals. And finally, one of the things that I do want to talk about is jobs and moving forward. So in this moment, we know that we are on the cusp of the fourth industrial revolution, right? We are now on Zoom all the time. We are now thinking about new jobs. And so when we are thinking about how to uplift our community, we definitely have to think about the new waves of jobs that will be created in this industrial age, and also how to help individuals who are in the service industry, who are in blue-collar jobs that might not exist in a couple years, how we can help them move forward. So for example, the administration just released a website called findsomethingnew.org, and it provides a list of career pathways that many in our community might not be aware is available to them. They are careers in tech, for example, careers in transportation. And not only does it provide those career pathways as well as the expected salaries, there's a list of how to achieve those, right? So certificate programs, which degrees you would need to do this. And so when we're thinking about solutions, we are partnering with philanthropic donors, anchor institutions like FIU, and nonprofits to bring access to information and resources to our communities, so that while we know our past and what has caused these racial disparities, we also are moving towards the future, and with a special focus on these communities, trying to figure out how to build resiliency and to buffer the effects of racial discrimination, as well as what's happening in the pandemic. So thank you.
Thank you so much, Manuela, for your wonderful presentation. Now we will hear from Chief Paul O'Connell from Wilton Manor Police Department. You have the floor, Chief O'Connell. He may have frozen. So we can go ahead and move on to Charisse Grant from the Miami Foundation until Chief O'Connell is able to join us again. So you have the floor, Charisse.
Great. So thank you so much for the opportunity. This actually works out well going after Manuela, because I'm going to talk about this from the perspective of an institution and what it is that institutions who provide resources into the community have to think about. Before I dive into what is going to be sort of much more discussion about institutions, I want to share sort of a story. All of us who are probably on this call have stories about what drives us to continue the pursuit of trying to solve and overcome an issue that may or may not be solved in our lifetimes. And for me, prior to coming to the foundation, I was a reporter at the Miami Herald, and one of my early beats was Overtown. And I remember to this day finding about a family that had some young kids, ages 5, thought it was 5, who weren't in school because they didn't have the ability to get the child vaccinated or immunized to go to school. And when I finally found them, there was not just one, there were 3, aging up to age 8. And sort of it's at that moment you ask yourself, what is it about our systems that not only a 5-year-old, but an 8-year-old could miss that much school? And no one would seem to notice. They were invisible to the system. And what is it about the way our systems and institutions operate that needs to be looked at for the long haul? So I'm going to share about what the foundation is doing, what we're trying to do, in hopes that what we're doing, where we succeed, where we fail, can inform others. And I'm coming at this from a point of view that racial equity is and will be our most ingrained inequity. Intentional racism was codified, socialized, normalized into our country from its times of inception into humanizing in institutional ways. And so eradicating that does and will always require our intentional, specific, sustained focus, not just when the pent up pain explodes, but even when things are quiet, it does not mean the issues have gone away. So the question for us as a foundation has been, what's our part? What's our role, both in the problem and the change? I want to be sure that folks understand a bit about the Community Foundation as context for this. People know us for Give Miami-Dade, people know us for grant-making programs, but I think it's important to understand how we operate and what we are. We're a $350 million community foundation. There's 700 community foundations across the country, and they are public charities based on place. Our place is Miami-Dade County, and it was established in 1967. But rather than like a private foundation where all of that money came from a single donor, we are a collection of funds, 1,000 funds and growing, created by fund holders. So the public-facing programs that people see in terms of being able to apply, those are dollars where the foundation has the control, the ability to design public-facing programs. But there's large amounts of money where we are a philanthropic service to the fund holder, and those decisions about where the money is going and who receives it is from the fund holder, not the foundation. So we don't have the ability to turn on a dime and take all of that $350 million and make decisions about, okay, it's going here, here, and here. There are large chunks of it that we have that ability to do. And we aggressively try to raise those types of funds so that we can focus on specific issues in the community. The foundation is not doing what Emanuela does. We're not a direct service provider. What we see and learn and our ability to respond depends on organizations like hers and the folks who are doing the work on the ground. What we do have is that we receive about 2,000 funding requests that we will review over the course of any year. And across the board, we're able to see and understand and get a picture of what's happening in the community, what the needs are, and how nonprofits are responding on a much larger scale than any individual nonprofits could have on their own. And so through our grant-making programs, we do have resources for areas like well-being of children and youth, education and health for them, affordable housing, economic issues, and arts and creativity. And we also, because the foundation is ever growing, we have the ability to design specific funds and funding programs to try to get at issues that may emerge, and in particular, leverage our networks of donors who have funds and outside to try to draw attention and resources to that area. But in order for all of this to work, we understand as a foundation how we operate, how we make decisions, how we distribute those resources has a vital impact on, are we creating the organizations and ecosystem in the community that is diverse enough and tackling these issues from a range of ways, because they're the ones working on the ground. So that leads me to the Racial Equity Fund. And as I talk about the Racial Equity Fund, it's important for me to remind myself and others that the Racial Equity Fund was a means to a beginning. It was not intended to be a defined end. So on the 8th day, our CEO was officially at the foundation, as all of the, across the world, the reaction to the horrific murder of George Floyd was playing out. She wrote a blog called Together, Let's Take Action. We had a brief internal discussion about, this is gonna put us on the radar. This is going to attract attention. Should we have our own house in order in terms of how we operate and a full plan before we plant a flag around, as an institution, this is an issue we know we must step up to take action on. Don't have all the answers, but we decided, let's go. It was a call to action as much for ourselves and those connected with the foundation as it was for the larger community. We'd lean in, we'd get engaged, we'd get uncomfortable, we'd make mistakes, we would learn, and we'd do more better. So the Racial Equity Fund was, we don't have a lot of unrestricted money, but what we do have and what we had available, we seeded the fund. We stated what our intent was, what our priorities were, and that was to leverage attention and additional resources to can we create resources that can invest in both organizations on the ground now and change that needed to happen in the long term. It's not a huge fund. It may not be a huge fund, but it's helping us begin to operate in a way that I believe will have not just a great effect on the foundation, but the community in the future. So, speaking about this, when responses require that you do things differently. So there are grants listed on their website of the 8 grants that we made, and I'll highlight a few of them in a minute. What they don't tell you is what we learned about what it takes to actually really get at issues of racial inequity and getting to the organizations in particular that are doing them that we may not know about. Those first round of grants were about seizing the moment. Typically, we do an open call. It takes months to move money. We have 52 years of history. And we also have people, I know people who were watching what was happening in the community. And we made a decision that we were going to find and invest in organizations that had less direct access to institutional money, that had boldly stepped up to the crisis in that moment, and they had roots, origins, leadership embedded in neighborhoods long experience in racism and social inequity. We defined that, and then for our first round, we wanted them to be representative of here's the first round, here's what we know we need to do and find more of. And it drew out individuals who then came with other organizations that were not on our radar. And so we are now, as a result of this process, hopefully beginning to build relationships to surface organizations that have been doing this work forever. They had no formal attachment to philanthropy or resources. For a second round, which we're going to announce in a couple of weeks, we scrapped the idea everything needs to come through a nonprofit. And we reached out through our networks of more established organizations and said, we know you're embedded in these communities. You are an organization led by people of color. Here's what we're looking for. We're looking for individuals who are people of color, galvanizing outside the structure of a nonprofit, but making tremendous impact in the communities. And we're going to begin providing some awards that are small to support those folks who are doing that, but they don't have the structure of a nonprofit to do it. So readapting how we think about who we find, how we find them, who knows us, who doesn't. The Racial Equity Fund and the approach that we're taking is a starting point for that. And something that all systems need to think about. The amount of work, the work was very different. It wasn't sitting behind a desk reading proposals. Instead, it became about engage. Don't wait for people to come to us. Make phone calls. If the individual didn't get the email, have your phone number, texting, the follow-up that is required and the reaching out as opposed to waiting for people to come to is so incredibly important and will be important in this process. And for a foundation, that could mean reorienting how we think about how we have our staff spend their time. Are we reading what people wrote on paper because they had a grant writer? Or are we finding other ways and other avenues in? So to the final point, so what does this mean for the foundation's role? And I'm happy through the questions to answer more about the Racial Equity Fund, but I think it's important what people see as the public end result is the beginning of a reorientation around how do we as an institution behave, and what are the ways in which we are inviting people in, and what are the ways we are essentially locking people out of access to resources. So for the role that we play, again, we're part of the funding system, and we have access to other donors. And so at this point, we have a staff of about 26, I believe. It's like we're adding a few more. Everyone on the team is involved in some way in looking at how the organization operates, who we support, how we operate, and how we lead as an organization. How do we use the funds that we deploy? What does our brand mean to people in the community? If you have a brand that tells some people, yeah, you're in the mix, and some people you're not, why is that? We know just from a preliminary scan of Give Miami Day, people who sign up, versus who applies to us, there are particularly Black-led organizations, they register for Give Miami Day, they have never approached us for a grant. Why is that? Like, what is it that is about our process or about their perception of our process that means a resource in this community that should be for everyone and supporting these kind of work is either not discoverable, it doesn't feel like it belongs to them, and by not being able to connect with and invest in those organizations as a foundation, we're leaving so much talent on the table. We are able to fund established direct services, but why do our systems not tilt towards advocacy, organizing, and movement building? We have to design those things. And so we're learning a ton, lots of conversations. We have 3 people who are doing nothing but listening tours with organizations that have not approached us. And it will play out in how we do future grant making across our programs, not just the Racial Equity Fund. So the closing for what's next, and sort of my advice for anyone who is working in an institution and sort of is part of the system, the relentless pursuit of the question why, and how we do things. And it's going to absolutely mean changing that. It's going to be more transparency about how we operate, and the relentless pursuit of building trust and relationships with folks who haven't come to us before as, yes, we do value what you do, and here's how we value it. And it's going to be a lot of work, but it doesn't mean that it can't be done. It doesn't mean we shouldn't try. And so the what's next is we will continue to try. We'll get some right, we'll get some wrong, but the ability of organizations to access resources, anyone to access resources, is critical to beginning to move not past, but make advances along racial inequity in particular. And so that's a snapshot of sort of what we're doing and why. And so we're proud to be able to, on our first round of grants, to be able to move more money to organizations like the Community Justice Project, the Circle of Brotherhood, who's a group of men who have been both doing advocacy but working with young men in neighborhoods forever, the YWCA and their 21 Days project, and so many others. And there will be more to come, but it's taken a really hard look and honest look at who we are and who are we here for. So thank you.
Thank you so much, Cherise, for your great presentation. Also, for all participants, we provided the link to the Miami Foundation and the Racial Equity Fund page in the chat if anybody wants to check it out. So now we're going to have Chief Paul O'Connell from Wilton Manors Police Department go ahead and make his presentation. Thank you so much again, Cherise.
Thank you. Good morning, everyone. My presentation is going to be about the Wilton Manors Police Department specifically, but more generally, the law enforcement profession. So whenever I talk about the law enforcement profession, one phrase, it's a military phrase that comes to mind. We have met the enemy and they are us. That truly applies to the law enforcement profession, is that we have some very poor hiring practices. We have some very poor training practices. And we have even worse, the ability to rid our ranks of those that don't deserve to wear the badge. So let me work my way backwards and start with ridding the rank file of individuals who don't deserve to wear the badge. There's currently a battle in Tallahassee, and it has to do with the Criminal Justice Standards and Training Commission. That's the commission that certifies and decertifies police officers and corrections officers throughout the state of Florida. Enormous power. It's being over-influenced by police unions. It's almost to the point that the tail is wagging the dog. I have fought consistently over the last few years with the Florida Chiefs of Police Association to try to get a handle on this Criminal Justice Standard and Training Commission, to give them a better ability to decertify police officers who don't deserve to wear the badge. That's a battle that's in progress as we speak. And if I look back over the last 9 years that I've been a police chief here in Wilton Manors, it's a battle that's not moving out of the trenches yet. It's very frustrating. Second, looking more specifically at the Wilton Manors Police Department, I came here in 2011, and it was a mess. The chief that I replaced, and the participants, attendees, please help yourself to do some research on the person who I replaced, left this department in shambles. So the first thing I started is our mission statement. And the mission statement is basically the foundation, the absolute core of what we do here in the city of Wilton Manors. The mission statement goes as follows: policing with passion for our profession and compassion for those that we serve. So the mission statement comes in two parts. Part one, policing with passion for our profession. It's a reminder that our profession is a noble profession, and we need to adhere to the professional standards. I think it forms the very core of what we do and how we do it, and perhaps more importantly, why we do it. The second part of the mission statement is a reminder that the vast majority of our job is compassion for those that we serve. Police work, yes, it can be a rock and roll a lot, but more than that, the substantial majority of our profession is serving people, whether they're homeless, whether their car broke down or they're in a car crash, a domestic situation, finding families that are in need. That is the substantial majority of our profession. So the mission statement acknowledges that when we say compassion for those that we serve. Again, going back to 2011 when I joined the Wilton Manors Police Department as their new chief, we did a cleansing, and that's probably the nicest word I can think of our department. At that particular time, we only had one African-American police officer and two female police officers. Fast forward to the current, we have 6 African-American police officers and 8 female police officers. We're moving in the right direction so that our police department reflects the community that we serve. That's an important goal for me. And it's a job that hasn't been finished yet. And I want to just point out and follow up on what Emanuela said regards the coming wave, the coming storm about evictions and foreclosures. That gives me more gray hair than you can see on the video right now. It is a storm that's coming. And we have an immense homeless population in Broward County. And it's going to get worse. It's going to get worse when this wave of evictions and foreclosures comes, and it is coming. So that is a concern that I have going forward. So I have a couple of things that I want to just close in stating. One, the battle, and I speak specifically the state representative up in Tallahassee. Please take a hard, long look at Florida State Statute 112, the Police Officer Bill of Rights, and take a long, hard look at the Criminal Justice Standards and Training Commission and the makeup of that commission. Right now, as we speak, the tail is wagging the dog in regards to police unions and the undue influence that the police unions have on that commission. That needs to change. Until that changes, the ability for police management to rid our ranks of those who don't deserve to wear the badge, that ability is not going to change. So that's a challenge that I give to Tallahassee and the House of Representatives up at the State House and the state senators at the State House. That's a challenge I give them, in that that needs to change, because it gives police administration the stronger ability to rid our ranks. And I want to talk about body-worn cameras. There was an article, and it's a local newspaper called the Pompano Pelican, and it specifically targeted Wilton Manors Police Department. We don't have body-worn cameras. If it was up to me, and even our police union, if it was up to them, we would have body-worn cameras tomorrow. Simply put, we are in a financial vice right now, with the diminishing revenues coming in as a result of COVID-19, and next year's not looking much better. So I just want to acknowledge that body-worn cameras it's almost standard. It's almost standard, but we haven't met that yet because of the financial crutch that we're in. I'm a firm believer, our union is a firm believer in body-worn cameras, because I believe it holds everybody accountable, not just the police officer, but the people that they're making contact with. It holds them accountable too. And the picture speaks for itself. So the police profession, a lot of challenges ahead of us, a lot of challenges. Challenge number one is changing the makeup of the Criminal Justice Standards and Training Commission, so that it better reflects police management and the ability to rid our ranks of those that don't deserve to wear the badge. Here at Wilton Manors, our ship is in order, but it's a job. What you'll never see behind me is a banner that says "Mission Accomplished." You'll never see that, because our job is challenging each and every day going forward. We know that, we acknowledge that, and that we're not perfect, and that we have a constant reevaluation, self-reevaluation going forward. One of the things that I want to touch on as far as training, implicit bias. We're all guilty of it. Even those that don't wear this uniform, we're all guilty of implicit bias. The training is to help police officers overcome that implicit bias, first by recognizing it, and second by muting it. That's important training that we have provided here at Wilton Manors, and it's something that's going to be needed for our law enforcement profession going forward. And it's not just a one-shot deal. It's something that needs to be reinforced year after year going forward. So for those that are very good at research, like Mr. Jackson, who I've had the pleasure of knowing for the last 10 years, maybe, here's a research challenge for you. The Sun Sentinel is our Broward County newspaper. In July of 2016, I wrote an op-ed, and the title of the op-ed was Our Journey for Justice. And it talks about the police profession and its ability or inability to communicate and work with the community. This op-ed came out just after the police-involved shootings in Baton Rouge and St. Paul, and then the assassination of the 5 police officers in Dallas, followed by, shortly thereafter, the assassination of 3 police officers in Baton Rouge Police Department. The op-ed talks about 2 critical failures. One, we have a broken society, and I think Mr. Jackson's PowerPoint presentation illustrates that beautifully. We have a broken society. And 2, our law enforcement system is under debilitating stress. Poor hiring practices, inadequate training, inability to cleanse our profession of those who do not deserve to wear our badge have combined to fuel the atmosphere of mistrust and strong belief, and a lack of accountability. That's right from the op-ed. actually specifically July 12, 2016. To my amazement, the Sun Sentinel came out with their own editorial the day after, July 13, 2016. Their journey, and the op-ed is entitled The Journey to Make After Dallas. And it says, one side shouts Black Lives Matter and the other side shouts Blue Lives Matter. Both sides are right, both sides are wrong. And that's where the ability to communicate between police and community is so critical going forward, so critical. So for those that are research oriented, please take a look at the op-ed on July 12, 2016, and the responding editorial on July 13, 2016. I also want to share with you a letter that I write to each police officer when they're hired. First, obviously congratulating on being hired by the Wilton Manors Police Department and being part of the noble profession of being a police officer. So it talks about the mission statement that I explained to you, the two parts of it, a passion for our profession and the compassion for those that we serve. It also talks about the expectations that I have of any police officer, any employee that works here at the Wilton Manors Police Department. Integrity is expectation number one. And here's what it says about integrity. Integrity is most important because it forms the very bedrock of our person and their standing in the community in which they live and the organization in which they serve. Integrity must rise above all else. Without integrity, a person is merely a voice without an audience. Courage is the second expectation. I expect our police officers and each one of our employees to have the courage to do what's right, even when it means turning in a police officer who has done something wrong. That happened back in November of 2019 when two police officers reported something that they saw was an unnecessary use of force. That is a internal affairs investigation that has not yet concluded, but I was very proud of those officers in that they reported a fellow police officer. That takes courage, and that's the expectation that I have of every one of our employees, the courage to do what's right. And finally, service. That's my final expectation in the letter that I write to each new police officer. Winston Churchill, one of my favorite quotes from Winston Churchill, is making a living is what you get, making a life is what you give. And that's the essence of the police profession. Yeah, we're going to get a paycheck every 2 weeks. But the more important thing is the life that we live in service to our community. That's the real reward in this profession. And finally, please go back to the Pompano Pelican. There was a op-ed that I wrote last month, and it's a direct response to what happened in Minneapolis. And it talked about the Broward County Chiefs of Police Association and the 5-step program that they have all adopted. It was June 5th, the president of the Broward Chiefs Association, Police Chiefs Association, and all the police chiefs in Broward County stood at the headquarters of the Broward Sheriff's Office, and we pledged their support for the following 5 points. The eradication of bad cops through early warning systems. We have an early warning system. We know it needs to be fine-tuned. It's never a job that's done. It's never a mission that's accomplished. It's always up to fine-tuning and updating. All the chiefs have pledged to that early warning alert system for police officers that perhaps they joined the wrong profession. A collective review of our use of force policies and implement change where needed. The Broward Chiefs of Police Association took out of the curriculum of our Broward Police Academy the chokehold in 2009. That's a thing of the past. We don't teach our police officers that technique. We teach them how to get out of it if they're in the unfortunate situation of being in a chokehold. We teach them how to get out of it. But as far as use of force, it's not something that we teach. It's not something that we endorse. And pledge number 3, continue to engage our community by including a diverse range of input. Another word for that, a single word for that, is collaboration. We can't do this job by ourselves. If we don't have the community with us, we are lost. And that's an important part of the mission statement here at Wilton Manors, is collaboration between the police department and those that we serve. Pledge number 4 is enhanced training to end bias-based policing and increase cultural sensitivity. I acknowledged that earlier when I said implicit bias, we're all guilty of it. The issue is, are we strong enough to overcome it when we are wearing this uniform? And that's training, constant training that's necessary going forward. And finally, repair the damage and restore the trust. Here we are in 2020, May 25th, 8 minutes, 46 seconds of a horrific application of police force, use of force. I was stunned when I watched the video, absolutely stunned. And we've got a lot of damage that's been done as a result of that. So we've got to repair that damage going forward. And that damage, the repair of that damage comes through collaboration and restore the trust. That's a challenge that's going to take years. So 2016 with the op-ed in the Sun Sentinel talking about what happened in Dallas. And here we are 4+ years later talking about what happened in Minneapolis. It's almost like there's an echo in the room. It needs to start in Tallahassee, and it needs to start with a commission, standard training, criminal justice, the Criminal Justice Standards and Training Commission, and the ability for police officers to be decertified by that organization to rid our ranks of those that simply don't belong in this profession. So a lot of work ahead of us, and I'm the first one to acknowledge. I'll go back to my opening statement. We have met the enemy and they are us. We got work to do. So I'll close on that. Thank you.
Thank you so much, Chief O'Connell. We really appreciate your presentation. So next, it was supposed to be Representative Cindy Polo from District 103, but unfortunately she had a family emergency at the last minute, so she's not going to be able to join us today. So we're going to actually move into the Q&A portion of the discussion. So Helen Roldan from the FIU Metropolitan Center is going to take the floor now. Thank you all so much for your presentation.
Thank you, Camila, and thank you so much to our speakers. So we have a bunch of questions that have come in this morning, and we're going to get started. This first question, it's actually going to be for Ned. So Ned, could you speak on one of the audience members asked about previous studies and current studies bear witness to disparities. What needs to be different, or is our role to continue doing studies?
Well, that's a great question. I remember when we did implementation plan for Miami-Dade back in 2000, the task we were asked to take on from then Mayor Pinellas was to look at the impediments to economic development in the Black community. And at the time when we took that study on and began interviewing community leaders, businesses, various organizations, we realized that there had been a lot of studies done since McDuffie. And here we were 20 years later. So instead of just calling it a study, that's why we called it the EDIP, the Economic Development Implementation Plan, because we did set forth, not only did we highlight a lot of the inequities and a lot of the other issues that really created a very segregated Miami-Dade, we did put forth a whole series of strategies to begin taking that on. So it's a great question, because here we are another 20 years later, and we have the hard data as William provided. I mean, what better evidence can you possibly have? But it's also I think there's a couple issues here. There's the systemic aspect of it that really needs to be understood, because that's the thing that just seems to transcend the decades. So we need to understand that and put that forward and all agree to that. The other thing is we need to make sure that our leaders, our elected leaders, and even our community leaders who are in very important positions, whether it be in various institutions, that they understand that once the evidence is there, they need to act upon it. They need to act upon it. We can't just keep doing studies. The Metropolitan Study Center does a number of studies over the years. We showed an example of just 4 of them. We put those forth for policymakers and institutions to move on it. And it's time we do that. All the evidence is there. We're at a critical time with COVID-19. The post-COVID economy is going to be traumatic. It already is. And if we don't start putting words to action, data to action, we're going to be in a real difficult time. And the most vulnerable populations, once again, who are already being hurt, will continue to be hurt for the years coming.
Thank you, Ned. This next question is for Cherise from the Miami Foundation. Cherise, one of our participants asked, how do community foundations address equitable economic development? And are you familiar with the foundations in Broward and Palm Beach doing this type of work?
My apologies if you hear something in the background. They're vacuuming in the hallway. Every community foundation, goes after these things differently. I think that most community foundations, because they're focused on local issues, will probably have a set of priorities that include economic development in some way. But again, their ability to focus on it and how many resources they have is dependent on this idea of a collection of which donors left money or created funds to address that issue. But it would surprise me if most community foundations don't have some grant-making category that encompasses economic development. Whether they're doing it proactively, whether it's just responsive grant-making, it completely depends on their own style and guidelines. And for every community foundation or any foundation, you really have to sort of look at their website or through conversation to understand how it is that they actually operate and what they have resources for.
Thank you, Cherise. This next question is for Chief O'Connell or any other panelists if they'd like to chime in. Does Chief O'Connell agree with shifting responsibilities to social workers, medical professionals, et cetera, away from the police? Is there too much responsibility on the police to deal with issues such as mental health or homelessness? Oh, Chief O'Connell, you're muted. Hold on 1 second.
There we go. All right. Yes, I do believe in that almost a handing off baton. Police officers are not truly trained to address these kinds of issues. The city of Eugene, Oregon has a great program called Cahoots. It's been in place for 10 years, 10 plus years. And basically it takes this challenge of dealing with those that have mental illnesses or homelessness, and it applies it, or it shifts the responsibility to social workers that are better equipped to handle these individuals as opposed to police officers. Too often, police officers are handed off a myriad of responsibilities outside their core training. This is one example. So again, for those of you that love a challenge as far as research, take a look at Eugene, Oregon, and the program called Cahoots. It's working.
Thank you. Would any of the other panelists like to speak on this? Emanuela, Cherise?
Sure, I could go. I think, so from the nonprofit side, I do think that there is a lot of opportunity to have the community engage in how we view policing, as well as the police department. So for example, the Urban League of Broward County has this community justice project where every year we bring together 300 families, students who are, or youth who are in our diversion program, as well as police officers from various municipalities in Broward County to have a conversation about their concerns, their griefs, things that have happened in their community, why they're fearful of police. And the purpose of that is to build trust. We also have programs within the Urban League where our youth who have gone through or are going through diversion programs get to interact with police officers in a non-confrontational setting, right? So the purpose is to build trust. With the protests that are going on around the nation, it's a grieving process for a lot in the Black community who's had to confront racial discrimination and police brutality for centuries. We are grieving the pain and the loss that we're feeling, and we need an opportunity to convene as a community to discuss this and to discuss solutions. Another project that we have, another role as a nonprofit is to serve as a convener. So for example, we have a child welfare race equity group that meets every month. And this is a group with the Broward Sheriff's Office, mental health providers, social workers, nonprofit organizations within Broward County that meet to discuss racial disparities in the child welfare system and what solutions we need. We also invite parents who have gone through the system, who have lost their children and gotten them back, to join us in this conversation to figure out what went wrong, what we could have done differently, and what access to resources could have been put in place to either prevent it or to build resiliency within these families. So as a nonprofit, our role is to bring law enforcement into conversations with community members so we can find solutions and build trust over time. It's not just one conversation, but continuous conversations over time to figure out the solutions to these problems. Thank you.
So the piece I will add, and I will take a tip from the chief, for those who are interested in research, those on the FIU team, when I look at the numbers that William put up about the proportionality of arrests of particularly Black youth, Black male youth. And, I look just at the pattern of my lifetime, and you sit back and ask, like, at what point did we start criminalizing things that used to not be a criminal offense? And if the proportion is what it is of those who will get arrested, each time we criminalize something that used to be maybe just mischief, because as a society, we have somehow defaulted to 911 when anything happens. And what are the things that we need to be looking at? And for us, are there community-based partners and sort of collaborations that can be built where, in partnership with law enforcement, when you need law enforcement, enforce the law. But if it's not really a legal violation, I worry about what's going to happen with masks. Are we going to wind up with a whole new group of people who now have a criminal record because they're not wearing a mask? As police are introduced into schools, which we absolutely need for public safety, are things that might have been mischievous among students now going to land them? And so how do we navigate this space of what needs to be dealt with as a human development issue and what is actually a law infraction? And how did we get so far towards having the police handle everything? And are there community-based solutions that we can look to that really help mitigate that and not have particularly young people wind up with criminal records for something where the police never should have been involved in the first place?
Thank you for that, Sharice. This next question is actually also for you. You talk about how the Miami Foundation as a funding institution is working to reevaluate and restructure the way it operates, making decisions and distributing resources, and opening the process and engaging grassroots organizations that have historically not had access to organizational money, or individuals making an impact outside the structure of an established nonprofit. How is your team rethinking monitoring and measuring impact?
So that's a good question. Stay tuned. And quite frankly, is one of the most important questions I think foundations have to ask themselves is not just how will we, but how do we now? And I think there are metrics that we use because of the focus on outcomes that don't lend themselves towards community organizing, movement building, advocacy, for example. A nonprofit can't promise, the Urban League can't promise me that, you know what, in 1 year, I'm going to have 3 wins on this issue. So what are the indicators we have to look at of traction? We have to develop those metrics, and that's going to be part of the work. But if we don't, we will continue to not support those organizations because structurally they don't fit into our system. We have to redesign the system so their value and the value that comes from movement building and organizing and grassroots work is reflected in the way that we look at those issues. That's the really hard work that we're diving into.
Thank you. This next question is for Chief O'Connell. One participant asked, can you please speak on how we can change the stranglehold police unions have? What can citizens and what can representatives in Tallahassee do? Or what is your opinion on this? Maybe you don't think it's a stranglehold.
I do think it's a stranglehold, or put another way, it's the tail wagging the dog. The Criminal Justice Standards and Training Commission, again, is an extremely powerful organization. The members are appointed by the governor. And it used to be, the makeup of the commission used to be a majority were police administrators. That has changed over the last 15 years. And now we have a very strong voice for police unions. Sometimes police unions don't have the police profession as their priority. They have protecting their members, even the bad ones. And that's their priority. And that's a priority that's out of sync with our profession. So the legislature needs to take a long, hard look at the makeup. They can change the law and the makeup of this commission. The ball is in their hands. And they should take a long, hard look at this commission, the makeup of the commission, and get a bill in place and get it to the governor's office. The iron's hot right now, so it's time to strike. And I think the overwhelming, I know the overwhelming number of our police chiefs and police administrators throughout the state would be very much appreciative of shifting the tide back to police administrators so that they can do the kind of discipline that's necessary. And in the extreme case, a decertification. And decertification, we refer to it as capital, it's called economic capital punishment, because you're out as far as police or corrections, you're out. And you're out because you deserve to be out. And right now, the burden of proof is too high, and that needs to change.
Thank you, Chief. And William, I think you may be able to answer this one. The Community Justice Project or others working on this, how can we all stay informed about policy to support and can protect those who will likely be facing eviction from this crisis the pandemic is causing?
Thank you, Helen. I think that might be a question that is more geared to Charisse, because I'm more familiar with the Justice Project of South Florida. That's the community project, which is in Miami-Dade County. So Charisse, are you able to address that question?
I'm not able to provide an answer for that question, but anyone who is working on that issue or knows of somebody who's working on that issue, whether it's an organization like the Urban League of Broward Legal Services, my email is cgrant@miamifoundation.org. Would love to begin to build and understand the landscape of who are going to be the folks that we need to protect against that, and knowing who is on the ground now in any capacity, whether they're working on it or they know the areas where people are getting most affected, We need those contacts, we need those relationships so we can be a bit more prepared as we have and leverage resources to move money to where it will matter the most.
So I'd like to add a point. I don't have a solution, but I echo Chief O'Connell's position that it is going to be absolutely terrifying when the eviction moratoriums are done, because we in South Florida, Broward and Miami-Dade, there is a huge ratio of people who are cost burdened when it comes to housing. We know this. If you spend more than 35% of your income on housing, you are cost burdened. And a lot of people spend more than 50% of their income on housing. And so if you have this flood of individuals who aren't working, then that means once the time comes around, you're going to have a huge population that has nowhere to go. So through our family's first program, one of the things that I saw was that a lot of the payments that we were making to landlords, so what we did was people would fill out an application, we would see their needs, and we would pay the landlord directly for 1 month's payment, right? That's not sustainable for a year. We also see that there are advocacy groups that are discussing unique solutions. So one of the things that we saw with our veterans population, because we have a veterans program, is that we would try to find temporary housing solutions for them. So what I think is going to need to happen is a collaboration within all players. So it has to come from government, it has to come from law enforcement, it has to come from nonprofits, it has to come from community members who are telling us what they need directly. And so a collaboration to figure out what radical solutions we can come up with.
Thank you so much, Emanuela. And I think we have time for one more question. So this next question is about access. So access to food, nutrition, health are a human right that is still highly unequal and disproportionately affecting Black, Brown, Indigenous, and the impoverished. How can we coordinate our efforts to support and build access to food, nutrition, and health that centers BIPOC individuals in order to organize local efforts to support folks that have been disproportionately affected by policy and systems in place, limiting their access to these essential human rights? Sorry, guys, I'm trying to edit it down. It's a long question. But can any of the panelists speak on this issue?
I can a little bit. So I agree, we need access to food. So when we're thinking about Maslow's hierarchy of needs, right? We're thinking about safety, food, shelter. So we definitely need access to food and nutrition. And I think the first route towards that is access to information. So we, for example, have a newsletter that comes out every day. Our philanthropic and communications department sends it out, and it has all the information you need about what's going on with education, what's going on with jobs, whether, you know, Career Source Broward has an upcoming program or not, and where the food distribution centers are. You can also find these on the Broward County website, for example. You can find a list of all the food distribution sites. And so one of the things that I believe is our role is to provide access to the information so that these families can go and find the food and resources that they need. We know that there's a need. Even in my own neighborhood, there are 3 churches located within a 3-block radius, and there's a weekly food distribution drive, right? And so I believe that our role is access to information as we also build resiliency within these families.
Thank you, Emanuela. Any other closing thoughts from our panelists? Okay, well, thank you everyone so much today for joining us. Thank you to our panelists. We had so many people actively engaged throughout the conversation today, a bunch of questions. Unfortunately, we couldn't get to them all, but we will be communicating with all the registrants later on today with a copy of the recording and the presentation that William gave earlier today. If you have any questions, we'll also be providing contact information so these conversations can continue. Thank you once more, and I hope everyone has a great day.
Thank you.
Thank you.